name is Stephanie Ernst, and I am the founder of TAP Support. And today is World TTTS Awareness Day. Now, I speak mostly about TAPS, and I think people are probably questioning why I'm talking about TTTS on this day when I usually speak more about TAPS and other complications. But I think it's really important that we raise awareness of all monochorionic twin complications. In relation to TAPS, it's also happens after laser surgery for TTTS, which is really important to know and to understand, and that it is a different disease to TTTS, but they can happen together. So that's why we're talking about it today. One of the things I am really proud to do is actually introduce you to Professor Asma Khalil, who many of you may know. She is the founder of the Jeff Ogg Health Foundation, but also a professor of maternal fetal medicine in both Liverpool, in the Liverpool Women's Hospital, and also at St George's in London. So I think what we will do is we will have a chat about TTTS, we'll talk about some myths, we'll talk about some basics around it, and today will just be a really nice conversation that you can take away and listen to at your own pace. So first of all, welcome, Asma. Thank you so much for getting up so early on a Sunday morning to talk to me. I think it's fabulous to have you here and also that we can have a chat like this.
Thank you for having me, and good morning, Stephanie.
Cool. All right. So I guess one of the basic things is that I probably think is really important to establish is that, yes, there's Awareness Day, and yes, we see this all the time around the place, and, awareness days exist, but we can say it's World TTTS Awareness Day, but what is twin transfusion syndrome and how does it actually happen and which groups are affected by it? So I will hand the floor over to you.
Thank you. Well, twin transfusion syndrome, or TTTS, is a condition that affects identical twins that they share one placenta, or we call it monochorionic. It's a Latin term which means one placenta. And all monochorionic twin pregnancies, they tend to share some vessel connections or blood connections. And when the blood flow across this connection is unbalanced, this is when you have a twin-to-twin transfusion syndrome, or TTTS. And it's a condition that's usually diagnosed by ultrasound or scans, and where one baby tend to have a lot of fluid, we call it polyhydramnios, excessive fluid, and the other baby have oligohydramnios, or very little fluid around it.
Excellent. And how common is it that it happens in these monochorionic twins or twins who share a placenta?
So TTTS affect 10 to 15% of this type of twin pregnancies is monochorionic, or the twins that share one placenta. And when it is severe, it can harm one or both babies. And unfortunately, in about 80 up to 90% in severe cases of TTS, we could lose one or both babies.
Wow, that's it's certainly definitely something that has to be screened for and watched very carefully when you are diagnosed with having these identical twins, of course. But how often should you be having these ultrasounds when you're carrying monochorionic twins, these twins who share a placenta? Is it more often or less often? How often?
So when you're pregnant with this type of twins, also the monochorionic twins, you need to have ultrasound scan every 2 weeks from 16 weeks pregnant until the end of the pregnancy. And at every scan, we'll be looking for twin-to-twin transfusion syndrome by measuring the fluid around each baby.
Perfect. And I guess then again, if you are diagnosed with TTTS, what are the treatment options for these twins?
So in moderate to severe TTTS, and the best treatment is a laser surgery. And this is almost a keyhole surgery. So through tiny telescope that we go inside the uterus, inside the womb, and seal these connections. As I mentioned earlier, TTTS occurs because of these connections, or the unbalanced blood flow across these connections between the twins. So using the laser surgery, you seal these connections. In mild cases of TTTS, not all of them would require treatment. Some of them, they just require monitoring.
Yeah. No, and actually that ties in with my own personal story because and many people know that I was initially diagnosed with TTS, and when I was referred to the hospital that treated me, they actually explained the same thing. And we went along the lines of expectant management, and our TTTS actually spontaneously resolved. So it doesn't always happen, but I know that that is one of the reasons why they tend to choose the less severe cases, the monitoring rather than the laser surgery straight away. But that's really interesting. And you mentioned earlier that there was a higher death rate, unfortunately, for untreated TTTS. What are the survival rates like after treatment for TTTS?
With the survival after the laser for TTS has improved over the years.
Mm,
So the chance of having at least one baby survives is 85%, even close sometimes to 90%. And the chance of both babies surviving is in the region of about 70 or 75%.
that's really fantastic, and it just shows how far that laser surgery and treatment options have come along for TTS, and it's amazing to hear that. So one of my big passions, of course, is being online communities and looking at the information that's available online for patients. And so I did a little bit of a Google search, and I'm hoping I'm not throwing you any curveballs here with this information. But I looked at some of the myths or some of the questions that people ask about TTTS online and in the communities. And one of the things is that one of the things that always comes up is things like TAPS, TTTS, selective fetal growth restriction. Are they all forms of twin-to-twin transfusion syndrome, or are they more just separate complications that can happen in line with each other?
So they're all conditions that are related to the sharing. You know, as I mentioned, they affect identical twin that they share one placenta or the monochorionic twins. And they're all because of the sharing, but they're different. They're not the same.
Yeah.
So TTTS or twin-to-twin transfusion syndrome is mainly difference in the amount of fluid around babies because of this unbalanced blood flow across the connections. While TAPS or twin anemia polycythemia sequence, which is difference in the hemoglobin concentration or the red stuff in the blood
Mm.
between the two babies. So, and that's again because of the connections, because of this slow passage of this red cells from one baby to the other. And therefore, you end up by one baby that has thick blood is too much hemoglobin, too much red cells. So it's almost like a ketchup blood. And the other baby, the one that's have less,
Mm.
is have very little red cells or hemoglobin. So that's almost have lemonade blood. So that's the TAPS. And then the third condition you mentioned, which is the selective fetal growth restriction, where one baby is a lot smaller than the other one. And that's because of unequal placental sharing. So that means one baby have a much smaller share of the placenta compared to the other twin.
It really is a case of that these shared placentas are not always such a great thing, are they? So, um,
I mean, I think on the other hand, I think we just need also to reassure the parents who have this type
yeah,
of twin pregnancies that still the majority will have normal outcomes and the majority will have
that's
two healthy
exactly.
babies and
Yeah.
healthy mothers.
Yeah.
So I think I think we just need to put things in perspective so that's not all bad news.
Yeah, exactly. And it just comes down to, I think, defining risk as things that can happen, not that will happen when we talk about these things. Another big thing that I found when I was looking at Google searches is what can stop TTTS prevent it happening, or rather prevent it from happening, or stop it in its tracks. And I found things like bed rest, protein shakes, taking aspirin, or any other lifestyle changes. Do any of these things actually work?
No, they don't. There's no really evidence, or there are no studies to demonstrating that there's any benefit in any of the things that you mentioned. I think what we know for sure from multiple studies is that laser surgery is the best form of treatment in cases of moderate or severe TTTS.
I actually also read too that some places recommend amnio reduction and have it on a parallel with the laser surgery amnio reduction, meaning that they go in and take some of the fluid out from one of the other babies, or even putting a tiny hole between the babies. And I think these are all questions that come up online. I kind of tried to keep it simple, but it led right into this. But so yeah, is there anything that people can do to prevent TTS?
Yeah. So I think to the point
Mm,
of what you mentioned about sort of the
yeah.
amnio drainage, which is a really simple, just taking some
Mm,
amount from the baby that has a lot of fluid, or sort of creating a hole in the membrane. And they're not really necessarily the recommended
yeah.
treatment for TTTS. I think if you are we're in a country where you have access to the laser surgery, and I'm aware that there are some countries in the world that they maybe don't have access to this
Yes.
technology. But if you do, I think that is a recommended first line treatment.
Mm,
While actually amnio drainage is only really reserved to very, very few cases where maybe occurs very late in pregnancy and or maybe in countries where you don't have access to the laser and you're not able to travel. The other thing is that in terms of about the monitoring, I think this is really important that these pregnancies have this monitoring by ultrasound from 16 weeks every 2 weeks, and therefore the early detection and timely referral to a center where you have the expertise in laser surgery. I think when we see sort of missed cases of TTTS is sort of maybe the one that they didn't have monitoring, or, the pregnancy was not really diagnosed appropriately as monochorionic or this type of twin pregnancy when they share one placenta, or maybe the referral was not timely. And rarely there is sort of acute TTS, which really happens overnight. And this
mm.
case, unfortunately, you cannot predict or you cannot identify early enough.
Yeah. No, and I think that's you made a very good point about lower income countries and countries that may not have the resources. It's always important to remember that while we do have these gold standards of treatment, that there are countries that do not have access to those. So there is always room to raise awareness about the treatment options that they do have. So I think that was a really important point you made there. Um, and I think one of the other things that I see, and one of the big questions I saw, it was a very high ranking question, was does a diagnosis of TTTS mean that you will always lose one or both babies?
Absolutely not. So, in fact, with advances in treatment, you can save both babies in most of the cases. As I mentioned, the survival following the laser surgery is 85% both babies, and maybe 75% at least one baby. So, it's not true that in most cases of the diagnosis of TTTS means you will always lose one or both babies. But as I mentioned, I think it's really important to use this opportunity of this awareness day of TTTS to help parents understand what TTTS is, and maybe share with them the evidence-based management, and also empower the parents to be able to understand what is the best practice and what's the best care they expected to receive.
Fantastic. And that actually leads me to basically my next round of questions, because you also know how passionate I am about patients and how making their voices heard in pregnancy. So I want to talk now about how a patient could talk to their doctor about TTTS either before they're diagnosed or during a diagnosis. And so if you are pregnant with monochorionic twins, what key questions would you recommend, or would you suggest that they ask their care team early in the pregnancy?
And once actually they've been informed that they have this type of twin pregnancy, which monochorionic share one placenta, and they really need to understand what potential problems could occur during pregnancy and what form of monitoring. As I mentioned, this ultrasound every 2 weeks. It's important that you confirm or reassure that yourself that actually are being monitored by healthcare professionals that have the relevant expertise in looking after twins. And if in an unlikely event that you develop one of these problems, that there is a process by which you can be referred to a fetal medicine specialist or fetal medicine center where they have the relevant expertise to offer the various management options. If it happened that you have this sort of TTTS, you understand how severe it is. So there are staging and what are the options. So, do you have always to have laser surgery or there is an option of maybe monitoring? So understanding how is it mild, moderate, or severe?
Yeah. No, and if it is suspected or diagnosed, you mentioned this a little bit, but what should parents ask to understand, like what stage they're at, what the risk level is, and what the monitoring plan is for that pregnancy?
Yes, I mean, as I mentioned, I think it's really from early stage in pregnancy, the very important in twins, you understand what type of twins, which I think many parents don't really have sort of good understanding of the type of twins. I think from my experience, most parents would say identical or not identical twin. I think what they perhaps maybe not familiar with is the fact that there's some identical twins that they will share one placenta and some identical twins that they don't share the placenta. They have two separate placentas. And the one that they share one placenta they have higher chance of developing problems and require really close monitoring
Yeah.
and ideally by healthcare professionals that have the relevant expertise, and also that there is a process in place that in the unlikely event they develop one of these problems, in particular TTTS, that they can be referred timely to the appropriate fetal medicine specialist or
Mhm.
center where they could be offered interventions or treatments.
It could be just as simple as asking where, if complications happen, where would you send me? And that's, I think, a really good question to add into your routine if you are pregnant with identical twins who share a placenta, that you can add that in. And if you are diagnosed, I guess the other thing is, what are the questions that you could ask about the treatment options, or when to consider laser surgery, or when is expected management, that watch and wait approach more appropriate?
Yeah, so I think mild cases of TTS were mainly really just a difference in the fluid. I think it's reasonable to monitor closely, so increase the frequency of monitoring. As I mentioned earlier, if these pregnancies are fine and there's no problem, in this case, we should offer ultrasound scan every 2 weeks from 16 weeks. But once you have early signs of problem or mild case of TTS, the frequency is should be more. So maybe at
Yeah.
least weekly, for example. But if you have a severe form of TTTS, in this case, you really need to offer intervention. And as I mentioned, the first line is the laser surgery, which is usually offered from as early as 16 weeks to as late
Mm.
as usually maybe up to 27,
Yeah.
even up to sometimes 28 weeks. It depends on expertise.
Yeah, exactly. And I think that's a really important thing to understand, is that every 2 weeks is what is guideline. If you don't and once the complications occur, that's when the monitoring increases. Yeah, so I guess the last thing to talk about is that earlier this year, both you and I collaborated on a project, and we actually developed a patient guide to the ESOG guidelines, which is another organization that you are very active with. And we created a guideline, we created a patient guide to the guidelines. And in this video, I will provide a QR code and a link to at the end to show where that is. In relation to the patient guide, it covers all types of twin pregnancy, and TTTS, TAPS, selective fetal growth restriction are included in there. But what I want to ask is, like, how can this help clinicians and even parents understand the types of risk in a twin pregnancy, how to explain it, and also how it can be used within the clinical setting?
Yeah. Well, I mean, the patient guide that you have kindly helped in preparing I think it's really useful resource for parents. It didn't just focus only on twin transfusion syndrome or
No.
TTS, or only even in identical twins. It covered the both types of twins. But
Mm.
I think what was really useful is that it was evidence-based. It was the latest information. It followed, the guidance that we actually issued for the healthcare professionals about how we diagnose, how we monitor, how we manage or treat the potential problems that occur in this type of twin pregnancies. And I think it's obviously there are various resources on the internet, but I think it's really important to have access to the accurate or the up-to-date resources, because you don't want to go to on a website where maybe you have misinformation or, as we discussed earlier, myths.
Mm.
And I felt that was really nicely written, and it was also have sort of illustrations to help parents understand something that's quite really complex for many people. So I think it's really useful resource that parents with twin pregnancies to be able to actually read, go through it, and go back again if something happened like twin transfusion syndrome, understand a bit more and match what they read in the guide with what they actually, the information that they get from their healthcare professionals or the teams looking after them.
No, and I think that's a really important point you made about you can find everything online and you can find information that suits what you're looking for, but it's learning how to differentiate that and also what is evidence-based. And information you find online, obviously, it's great, but I read a great quote and I wish I could credit it to the right person, but it said, Googling your symptoms only tells you which diseases have the best SEO, which is search engine optimization, and that puts you to the top of Google. And I think that's such an important thing to remember, that you should always take the information you read online back to your care provider and talk to them about what you've found. This is something I'm very passionate about because I think that creates better communication. And with the patient guide, thank you so much for the compliments in the writing. I think they're very flattered. But I think also it helps in this situation that you can go back as a clinician and you've got a resource that shows what the evidence is, how it's broken down, and you can talk about it on a level that is a personal level rather than a clinical level, because the last thing patients want to do when they are receiving a diagnosis is try to navigate technical or medical terminology. They want to have it in language that they understand. So that was really what I set out, was when I started the project, my immediate thought was, how do we make this a project where we can create more of a sense of trust in what the doctors are doing, but also how can we make it accessible that people can read it when they are in a time of stress and understand. And that was really what the purpose was. So, and like I said, the patient guide is such a big achievement because I think it's very unique as well. I haven't seen anything like it in relation to twin pregnancy yet. So it's also important in that regard.
Yeah, I mean, it's also important to use the opportunity to highlight that actually this is a frightening time for the parents. This is you've been given the diagnosis of TTTS, or particularly severe TTS,
Mm.
and where you've been told that without treatment, 80% or 85% of the cases you might lose one or both babies. I think it's obviously frightening, the statistics to be given to the parents, and certainly in many countries will be, or many hospitals will be advised that they need to travel and go to another
Mm.
center to see a team of healthcare professionals that they have never met before, and
Exactly.
undergo or have surgery, often quite quickly, often within 24, 48 hours. So it's really frightening time for the parents. And I think if I just use the opportunity to give a message to the healthcare professionals who might be listening to us, is that to ensure that we give the parents the right support that they need. And this support can vary from one couple to another. But I think it's really important that we treat the parents as the parents, not just as another case of TTTS. So I think it's really important that we also address the psychological stress that these parents are going through.
Yeah, and I think also another thing that is good to know is that when these parents under these in this situation, knowing what support is available to them, and even in the lines of which evidence-based support groups exist out there, because even though people will jump online and Google things, there are support groups out there that are, I won't say better than others, but have more access to information and can give a much more well-rounded and evidence-based point of view. And it's really important to know what is available because they can also complement what you're doing as a clinical professional. And I think that's a really important thing to highlight. And the good organizations will always try and reach out to you as well, I think, and that's really important to remember. So that's just my 2 cents on top of your fantastic already said thing. So I think this is a really a natural end because I think we really have covered everything that we could find in the relation to search terms. But Asma, I would like to just give you the floor and have let you finish off the conversation with anything that you think is super important that we need to cover.
Well, thank you very much, Stephanie, and thank you for actually really all your efforts and that you to raise awareness and give the parents appropriate, up-to-date, correct information that's given in a language that's easy to understand, and you do that all voluntarily. So thank you very much, first of all, and just use the opportunity that really the key thing is to ensure that the parents with this type of twin pregnancy receive the appropriate diagnosis and monitoring, the timely referral, and be managed by healthcare professionals with the relevant expertise. And again, just to really try to reassure parents that it's not always bad news. It doesn't always mean that you're going to lose one or both babies. But make sure that we bombard them with the information and make sure that they really understand and receiving the best care.
Absolutely. And I think, likewise, Asma, thank you so much for getting up so early on a Sunday morning, first of all, to talk to me. But secondly, for the passion that you have for this topic, and also the fact that you are giving out this information and working as a volunteer yourself, doing these things in many of the situations that we're in, and also that patients have someone that they can turn to like yourself. And if I really just want to summarize, the content of today is that close monitoring every 2 weeks is what is evidence-based. Laser surgery is the best treatment for TTTS, and risk really means it's not that something that it's not something that is going to happen. It will happen. It is more that it can happen, but close monitoring and following guidelines and evidence-based, these evidence-based guidelines means that the outcomes are good very much a lot of the time. So thank you for your time, Asma. I know you've got to run off to clinic, and everyone who is raising awareness today. Remember that awareness isn't limited to one day or 1 week or 1 month of the year, that it happens 365 days a year. And please talk about your stories, share your stories online, and most importantly, make sure that when you are sharing information, it comes from good sources. Thank you.
Pleasure. Thank you so much for having me, and have a good day.